She's got very little mobility. She hasn't got the vision, so it's impossible for Louise to cook a meal. She couldn't function without the care.
There you go.
But the council did try and cut Louisa's care, hoping to reduce her support hours by half in the face of their own funding black hole.
It was cut by half.
What did the council tell you about that?
Well, they just cut it.
With no explanation?
With no explanation. I didn't know how I was going to manage if it was cut so much.
Does it make you angry?
Yeah. And they shouldn't cut the services.
While ultimately lawyers fought to keep her care in place, the threat of taking Good away left her feeling so down she ended up feeling suicidal. It was Louisa's dad who had to pick up the pieces.
Louise just can't cope without that sort of fundings for when she gets up in the morning, lunchtime and tea and going to bed. She just can't move. She can't get out of the chair. I'm getting on a bit. And what I want to do now is to give her all the extra support to make her life happy whilst I can. That's not unusual, is it?
Do you worry about her?
I used to. Yeah, I used to, before she came here. But I'm far more relaxed about it now. I say, I'm 87, and we know what's happening around the corner. And I'm happy that she's safe here and she's going to be looked after.
Louise is amongst the tens of thousands of people who rely on social care in their homes, but have seen their support packages face cuts in recent years as cash-strapped councils tighten their belts. Now, in research exclusively compiled for Channel 4 News, social care providers say the budget has made things worse. Care providers now face a hike in national insurance and an increase in minimum pay. 6 of the country's key providers told us that 1 in 8 support contracts they provide councils are not financially covered, with the added costs from the budget meaning without a 9% funding boost, they'd all be loss-making, raising the risk of closures and even, some say, a collapse of the whole system. Helen runs one of the biggest charitable care providers in England.
Hi Helen, how are you?
Oh, I'm really well. Hi Nathan.
She says
Nice
supporting people like Nathan in his own home helps build confidence and puts less pressure on the taxpayer.
It's made a massive difference to my life because before I would barely leave the house.
But not everyone is getting the kind of assistance Nathan has got.
How serious is this situation?
It's so serious that we're really raising the alarm. I think there's a really visceral sense of anxiety and concern, and we think that major intervention is needed between now and April if we're going to prevent a sort of collapse of the social care system.
In the days before Christmas, the local authority provisional budget for next year will be announced, but charities calculate there won't be enough to go round.
Are you hoping for answers within that provisional budget?
We believe that social care cannot take the brunt of the gap in public finances.
You know, local authorities say they don't have enough funding. Central government, you've seen the Chancellor, she's out and about saying that departments have to live within their means. There is no more money left.
I think that many organisations will start to struggle in a way that means that they could become insolvent.
They could have to close.
Yes.
Hello there, hi.
Just yesterday, the Chancellor visited a hospital in Maidstone to talk about plans beyond next year and warning departments to make the pound stretch.
For our NHS to work effectively, we need a social care system that works. That's why at the budget I put £600 million into investment in social care. That's why we are introducing a fair pay agreement to improve recruitment and retention. So we're committed to a national care service.
Kirklees Council, who fund Louisa's care, told us,
"Our priority is to enable every resident to live independently in their home setting for as long as possible. Like other councils across the country, we are seeing an increasing demand for adult social care that must be met within available resources. This situation will continue until there is a national, long-term and sustainable solution for social care funding."
It's getting harder to stare now, isn't it?
Politicians all agree how important social care is, but so far they've failed to find the cash to match the ambition for real change.